Hi friends, my name's Jessica and I'm a second-year doctoral student studying nursing practice. And today I want to talk to you about having imposter syndrome as a new grad nurse. So what is imposter syndrome? Essentially, imposter syndrome is self-doubt and feeling like a fraud. If you want to learn more about imposter syndrome and the different patterns, you can check out my other video I'll link up above, which goes through all the different patterns and types. However, I wanted to make this video because I do find that a lot of new grads coming in and working as new nurses have a lot of self-doubt and often feel like they're an imposter and that they're a fraud. And how can you translate that studying role of a student into the practice of a nurse where people's lives are in your hands? So when I talk to a lot of nursing students, things that they bring up related to imposter syndrome are thoughts like that they didn't have the best clinical, that they were good students, but how do they put that book knowledge into practice? And also that this is real life nursing and people's lives are on the line. It's not just an exam or a test. People may question or ask themselves, will I be able to deal with an emergency situation? All of these new roles and responsibilities of a new grad nurse can really cause that ruminating self-thought and self-doubt. I know when I was a new grad nurse, I felt this as well, because you are going from the role of a student to almost the role of a teacher, because nurses, we are teachers and we are healing and helping people, and our roles and responsibilities affect people's lives and their outcomes. So it's a lot of pressure. It's very scary as a new grad nurse, and you may feel like an imposter. You may feel like, oh, I got through the exams and I did well and I knew the information, but am I ready to be a nurse? Or am I feeling kind of fraudulent? Or I shouldn't be here. Am I going to be able to conduct assessments? Am I going to be able to find when things are wrong? Am I going to be able to react in emergency situations? So how we can combat this is that you need to remember that you're not alone, and these thoughts and feelings are pretty normal for a lot of new grad nurses. Another thing is it can be very stressful. People's lives are in your hands. So it's good to remind yourself that you're not alone. Have a longer orientation because you're a new grad. You also have all the other staff nurses on the floor, as well as a charge nurse, as well as a nurse manager who oversees the floor, as well as a nursing supervisor who will oversee the entire building. If you have a question, it's okay to ask, because if you're nervous to ask questions, just know that you not asking the question is actually slowing the team down. If you ask the question, you can learn the correct way to do things, and then in the future you can teach others, and it's kind of a spiral effect, right? And this is why precepting new nurses and having a good preceptor is really important, because when you are that experienced nurse, you'll be able to give back and help other people as well, and you'll remember how you felt as a new grad. The other tip that I have is every hospital or unit has a policy and procedure manual. So if you ever have a question about anything, or you're just not sure what you're supposed to do for this certain task, as long as it's not a life or death situation, you can always check the policy. So if you need to know, oh, if my patient is getting this certain treatment, how often you need to take vital signs, or when do you straight cath without a doctor's order, all of those things are going to be in the policy and procedures. So you don't always have to ask other nurses questions. You can also just look it up in the policy and procedure book. And it's great because it's like a direction of how to conduct your nursing care. So that's a great resource. Also, I want you to remember that as a new grad, you will get a longer orientation. And this is great because you have more time to learn the floor, learn about the typical patients that you will be caring for and the typical illnesses that they have. You'll also learn how the floor runs, how to conduct admissions and discharges, and you'll have more time to practice all of these things. Lastly, you'll be super surprised at how quickly you pick things up. At first, it can seem very overwhelming being a new grad nurse, but a year in, 6 months in, you're going to feel like a pro, because you just really are going to catch on to how the floors run, who you can ask for help, the way that the medical providers work on the floor, the way the interdisciplinary team works on the floor, and you'll just be really surprised at how quickly you pick up the daily tasks of your day. So yes, as a new grad nurse, it is very common to feel like an imposter and have these imposter syndrome thoughts because you are caring for people who their life is in your hands essentially. And this can be very, very stressful and you can have a lot of self-doubt. But again, just know that you've worked hard for this, you have the knowledge in your brain, and you have the resources available to help you. And soon you will be that resource person for another new grad nurse. So I hope you guys enjoyed this video. And if you liked it, give it a thumbs up and make sure to subscribe below. And I'll see you guys next time. Bye.